Okay, I'm going to teach you guys how to do McConnell taping. So first of all, you need a tape called Cover Roll Stretch and another one that's called Leuco tape. It looks like this. Oopsie, that's good. And then this is to help with what's called a medial glide. So you're trying to medially glide the kneecap. So you're going to take the backing off, which is actually one of the trickier parts. So I usually lay it across my thigh and take the backing off. And you'll notice if you watch a lot of videos on this, there's actually a ton of small variations, but this is what I found works best for me. Go ahead and straighten your leg. You're going to take the tape from about what would be considered the lateral joint line, so basically halfway on the side, and you're gonna go all the way around to about where the hamstring is. And when you put the tape down, if I were to mark the kneecap top and bottom, I want you to bias it very slightly low. And the reason why is because when you bend your knee, it's gonna look like the tape moved, and I want it to be over the kneecap as much as possible throughout all movement. So I make those little white marks, and that kind of gives me a guide. Now your knee is not a cylinder, so your knee is not going to be perfectly round. That's normal. See this little crease here? If you were a coffee can, maybe it would be straight, but you're not. The next thing you have to do is the patient or the person has to be relaxed. If they're not relaxed, you can't move the kneecap. So just for example, that's not relaxed, tighten. Yep, and see now I can't move it, so they have to be relaxed. I probably put that just no, that's pretty good. It's maybe a smidgy lower than I was thinking. Go to the outside edge. There's the outside edge of the kneecap. You're gonna take your thumb, push the kneecap in pretty firmly, grab the flesh, crunch it together, and then put the tape down. If you've done it correctly, I call this a little butt crack of the knee. You should make a little butt crack right there. And then you can test it and give it a little push when they're relaxed. Does the knee move a lot? And actually this is pretty good. We probably don't need a second piece of tape. But if it's still wiggled a lot, sometimes the first piece just moves a lot of flesh, but it doesn't really move the kneecap much. If you need, put a second piece of tape down, and that should keep the knee in place.
If you're a patient at Apex Wellness Providers, this video has been made for you to help assist in your technique for your health and wellness journey. If you're not a patient, please use this for educational and entertainment purposes and is never a substitute for your own individual medical advice.